All right. Hi, my name is Becky Sanders, and I am the program manager for the Upper Midwest Telehealth Resource Center. Thank you for joining us today for our discussion, our virtual office hours on Medicare billing for telemedicine. I'm going to get my slides ready here and go ahead and share my screen with you. All right. Can everybody see my slides here?
Yes.
Okay, thank you. All right, so our topic today is Medicaid billing for telemedicine. We're going to cover three main topics or objectives today. So how do you bill for a telemedicine visit with a Medicaid patient?
You know, the boys
what
are,
if your patient doesn't have internet access? And what if your patient's at home? So we're going to talk about those three things. This first thing that I want to do is really just to go over what does it look like when you're billing for a telemedicine event. Hang on just a second. There are two pieces to billing for a telemedicine event. What we call the originating site or the spoke site or the patient site. And if the patient is in a normal clinical office setting for a telemedicine event, say that they're in a physician's office and then they're being seen by a specialist at a more urban hospital. So they're at their primary care facility and have set up with a computer or a monitor on an AV cart or on the wall to talk with a specialist at a distance. So in that case, the facility where they're at, that physician office, would bill what's called the facility fee. And the code, the CPT code for that is Q3014. And this is the same if it's, we're specifically talking about Medicaid today, but this is the same if you're billing Medicare or Medicaid or a commercial insurance company, so that any payer. So that, and again, that site is in regulation is called either the originating site or the spoke site or the patient site. And then the other part of billing for a telemedicine event gets billed by the provider. So that could be, that's again, in regulation, it's sometimes called different things. It could be called the distance site or the hub site or the provider site. But that is where the specialist is, or the behavioral health specialist or the cardiologist or the neurologist or whatever is delivering services to a patient who is at a distance from the provider. And that provider bills their normal telemedicine or their normal service fee, because the service that is being offered via telemedicine is the exact same service that the patient would receive in person, but it's being offered at a distance via telemedicine. So that same CPT code applies, and it gets billed on the Part B professional fee form, the $1,500, and there will be modifiers involved, and we'll talk about those modifiers in just a few minutes. So that is a normal telemedicine billing situation. Now, with the advent of COVID-19, the actual
Blair, doing good.
person receiving those services could be at home.
Yeah, sure.
We have got somebody who is not muted. There we go. I think we got it. So if the person's at home, there is no facility fee to be billed. For the 4 states that we cover in the Upper Midwest Telehealth resource center area, Illinois, Indiana, Michigan, and Ohio. Only Ohio Medicaid previously, before COVID-19, allowed patients to be at home. So again, if the patient's at home, there is no Q3014 originating site facility fee to be billed. There is only the professional fee that gets billed by the provider. Now, right at the beginning of March, before COVID really hit in the US, Michigan Medicaid had already been working on opening up their originating site. And start back to March 1st, retroactively, they are allowing patients to be at home. Now there's additional waivers on top of that that allow patients to be at home because of the COVID-19 public health emergency. But the Michigan Medicaid, that part of Michigan Medicaid will continue past the public health emergency. Indiana and Illinois have not said if they're going to continue to allow patients at home after COVID-19 or not. We'll have to wait and see. I don't have that crystal ball. I want to stop and make sure that see if there's any questions. Make sure that this is, that you guys are understanding this, because everything else is going to be based on this conversation of understanding how a telemedicine event gets billed. So you can unmute yourselves or put something in the chat. We have a question. What about ALFs? I'm sorry, I have no idea what an ALF is. Oh, assisted living facility. I know that for the most part, SNFs, I can't remember what the acronym stands for.
Skilled nursing facilities.
Thank you. Thank you. Skilled nursing facility. My head just had a brain fart. Skilled nursing facilities are covered. But I'm not sure about assisted living facilities, as they're different. We would have to double check the Medicaid provider manual for the individual state, because each state Medicaid program can be a little bit different. So we'll give you resources at the end so that you can dig into that more, and Luke or I can help you find that if you have issues. All right, any other questions about how you bill for a telemedicine event? Okay. All right, so when your patient's at home, we already talked about you're not going to bill that originating site facility fee. A lot of questions we've gotten with patients being at home. What about vitals? You can't do that normal physical exam, so you're going to have the patients help you if there's something that you need, as far as muscle tone or palpation, and there are some guides out there on that. But most patients are going to have at least a thermometer in their house, so they can take their own temperature and tell you what that is. They might have a blood pressure cuff. That's pretty common. They might have other things. They might be able to know how to take their pulse, or they might have some type of an activity monitor to take their pulse. There are also a lot of Bluetooth devices available. They're becoming more common on the open market for consumers, that they might be able to do other vitals at home as well. Or they might have a family member who is a doctor or a clinical provider that can help, with heart and lung sounds or something like that. One of the opportunities for seeing patients at home is you see them in their normal environment. A lot of times, the patient could be a lot more comfortable, maybe able to open up more about what's going on because they're in a safe environment for them. We have done several recorded events already. Wanted to specifically draw your attention to the website manner, the video etiquette. If you go on to the UMTRC website under events and look at archived webinars, you'll find that. Also consent and documentation. I forgot to add it to this slide. I'll add it before we post these slides. The other one that we've done is on consent and documentation. We've gotten a lot of questions on that as well in the last couple of months. So we do encourage you certainly to go out and review those resources on our website. Any questions about what to do if your patient's at home? All right, so I talked a little bit about some of the exceptions for COVID-19, specifically the waiver allowing patients to be at home. One of the other big exceptions for COVID-19 is that you can use the telephone to communicate with your patient. If your patient doesn't have a smartphone or a tablet, or they just don't have adequate broadband, during COVID-19, you can use telephone to connect with them. Talking about Medicaid today, so in the Medicaid guidance, again, each state's a little bit different, so you'll have to dig into your provider manual for your state or read through the bulletins that have come out from your Medicaid state department to see exactly what they want you to do via COVID-19, and we'll give you all those resources. Some of them are, and we'll talk a little bit about modifiers here in a minute, but most of them are saying that they want you to say in the remarks on the billing that was provided via telephone services, but are still saying to use the same CPT code that you would normally use. The other big thing that's changed for COVID-19 is at the federal level, they've relaxed the HIPAA rules so that the platform that you use doesn't have to be HIPAA compliant. Now, during this public health emergency, we certainly want you to do whatever's best for your patient to take care of them. States in our region are starting to open up, but there still is, a lot of concern about social distancing, and especially if your patients are immunocompromised to begin with. We want to keep them safe at home and not having to go out in the general public if not necessary. So long term, we certainly want you to use a HIPAA compliant video conferencing platform with your patients, and we have resources for that as well. But know that as long as your state has a public health emergency, that you're going to be able to use non-HIPAA compliant video conferencing platforms. So that could be like Facebook Messenger, video chat, or Google Hangouts. You just do not want to use something that's public facing like Facebook Live or TikTok or any other platform like that. Any questions about the telephone exceptions? All right, so place of service codes. And again, I want to provide this information to you, but again, for your individual state Medicaid program, double check and see what they want you to do. For example, and we're not going to get into Medicare today. I'll refer you to previous recorded webinars on Medicare. But Medicare has changed the way that they want you to use the place of service codes. So normally, if the event takes place via telehealth, you're going to use 02 as your place of service code. But there are codes for school and office and home and Indian facilities, federally qualified health centers, community mental health centers, and rural health clinics. All right, so we have developed, and on our website, we're going to jump out and go to the live website. We have developed a lot of state summaries and updates for you. With COVID-19, we have just been able to integrate all of the stuff on our COVID page that I'm going to show you with all of the normal stuff, and we'll be updating those this week. So you guys are getting a preview of that. So I'm going to jump out here and let's go to the live website. So if you go to, from the main page on the live website, if you go to COVID-19, you'll see we have a whole host of resources, toolkits, Medicare information, and then individual state information. Autumn Daniels has done an awesome job updating these. So each state, you can see what's going on as far as reopening of their businesses and stuff like that, and their plans, and then down in reverse chronological order, you'll be able to get to back all the bulletins and different information released from the state, executive orders, that type of thing, talking about changes to Medicaid programs. The other part of the website that we're getting ready to update is under our policy and reimbursement. Oh, sorry, that was a weird link. Let's go this way, and we want to go to reimbursement. So you can see if you just hover over this, this is where I'm going. We've got the pop-outs here for the different resources on this. So on this page, you can see the, and they're alphabetical here. So starting with Illinois, and then the other states, you can see the individual state reimbursement summaries. And so wait till tomorrow or the next day to go out there. We'll send you, everybody that's registered for today, we'll send you a notice when the new ones are actually up there. But they have been updated. I'm going to show you this one right now. Drag this over. And this one is a summary of all 4 states, what's going on with, as well as Medicare. So what's going on with Medicare, where you can find all of the waivers for Medicare. But this is what I really wanted to show you guys today. So you can see, there's a column for each state. So Illinois, Indiana, Michigan, and Ohio. Where can the patient be? So here we see that, the originating sites. The distant site is where the provider is at. And then what type of eligible provider, and each state has, some language. They have to be enrolled with their individual state Medicaid program to be eligible. Right now, you see all the HIPAA requirements being relaxed across all 4 states. And synchronous communications, and you see Ohio is allowing asynchronous, which would be kind of like if you take a picture of a wound and send it for analysis, and then they come back and tell you about it later. Most states are now allowing patients to be established and seen via telemedicine for the very first time, that the patient and the provider are establishing that relationship. They can do that now via telemedicine. Here's your modifiers. Place of service 02, which means it's done via telehealth. Everybody else is still using the GT modifier, and that's what goes on the provider bill. Some references about patient consent. Again, that we've done separate virtual office hours on that, and information on reimbursement and the facility fee. So there are conditions. Obviously, if the patient's at home, you're not going to bill that facility fee. And then we see the individual language for each state where you can go and find those bulletins, different information that affects FQHCs and RHCs, and that follows through for every single state. So I wanted to share that information with you today. Questions about those resources? Okay. So this is the last page. We've got about 9 minutes left for general questions and answers. Again, if you're as a registrant from today's virtual office hours, you will, we are recording today's session. You will get an email when we get the recording posted to our YouTube page and when we get the slides posted to our website. There's email addresses for Autumn and Luke and I will clean up the errors on that slide. Any other questions today that you would like to ask? All right, I think Autumn's going to put, she's put several resource links in our chat box today. And also, if you want to go ahead, Autumn, and put the survey link again so everybody gets that. Thank you. We do these surveys so that we have information to send back to our funders. Also, if you have questions or would like additional topics covered during our virtual office hours, you can request those as well. All right, well, thank you for joining us today and have a great rest of the day.
Thanks, Becky. You too.